Schizophrenia is one of the most misunderstood mental disorders. In everyday conversation, the word is often used incorrectly, sometimes as a shorthand for a split personality or unpredictable behavior. But schizophrenia is not about having multiple personalities. It is a psychiatric condition that can affect how a person perceives reality, organizes thoughts, expresses emotions, and relates to the world around them. For some people, it may involve hearing voices that others do not hear. For others, it may involve strong beliefs that remain fixed even when evidence points the other way. It can also make speech, behavior, motivation, and emotional expression harder to understand from the outside. The condition usually develops gradually, often emerging in young adulthood, a time when people are building independence, education, work, and relationships. That timing can make the impact especially disruptive. Understanding schizophrenia means looking beyond stereotypes and seeing a complex medical condition that affects real people, families, and communities. The symptoms of schizophrenia are often grouped around changes in perception, belief, thinking, behavior, and emotional expression. Hallucinations are one of the best-known symptoms, and the most typical form is hearing voices. These voices may seem external, intrusive, critical, commanding, or conversational. To the person experiencing them, they can feel intensely real, not like imagination or ordinary inner speech. Delusions are another major feature. A delusion is a firmly held belief that does not match reality, such as believing one is being watched, controlled, or targeted in ways that are not actually happening. Schizophrenia can also involve disorganized thinking, where thoughts may become difficult to connect, and speech may seem hard to follow. Behavior can become disorganized too, making daily routines, hygiene, school, work, or social interaction harder to maintain. These symptoms vary widely. Two people with the same diagnosis may have very different experiences, levels of insight, and support needs. Another important part of schizophrenia involves what clinicians sometimes call negative symptoms, meaning abilities or expressions that are reduced rather than added. A person may show a flat affect, where their face, voice, or body language expresses less emotion than expected. They may also show inappropriate affect, where emotional expression does not seem to match the situation. This does not mean the person has no feelings. Often, emotions are still present, but they may be harder to express or communicate. Motivation can also decline, making ordinary tasks feel overwhelming. Social withdrawal may appear, not because the person does not care, but because interaction can become confusing, exhausting, or frightening. These symptoms are easy to misread as laziness, rudeness, or lack of interest. In reality, they can be among the most disabling aspects of the disorder, especially because they affect school, work, friendships, and independent living over time. Schizophrenia is not diagnosed with a blood test, brain scan, or single objective laboratory result. Diagnosis is clinical, meaning it is based on a careful assessment of symptoms, history, behavior, and context. A mental health professional listens to the person's reported experiences, observes patterns in speech and behavior, and often considers information from family members or others who know the person well. This matters because symptoms can unfold gradually, and someone in the middle of psychosis may not fully recognize what has changed. Formal diagnostic systems set time requirements. Under DSM-5 criteria, symptoms must have been present for at least 6 months, including periods of active symptoms. Under ICD-11 criteria, the required duration is shorter, at 1 month. Clinicians also need to consider other possible explanations, including mood disorders, substance use, medical conditions, and other psychiatric disorders. A careful diagnosis is important because treatment choices and long-term planning depend on understanding what is actually happening. Many people diagnosed with schizophrenia also live with other mental health conditions. Mood disorders, anxiety disorders, substance use disorders, and obsessive-compulsive disorder can occur alongside it. This overlap can make diagnosis and treatment more complicated. For example, depression may worsen withdrawal, low motivation, and suicidal thoughts. Anxiety can intensify suspiciousness or make social contact even harder. Substance use may begin as an attempt to cope with distressing symptoms, but it can also worsen psychosis or interfere with treatment. Obsessive-compulsive symptoms may add repetitive fears or rituals that further reduce quality of life. Because of this, schizophrenia care is rarely just about reducing hallucinations or delusions. Good treatment looks at the whole person: sleep, mood, anxiety, substance use, physical health, safety, relationships, housing, and daily functioning. When co-occurring conditions are recognized and treated, people often have a better chance of stability and recovery. Schizophrenia is relatively uncommon, but its impact is large. The lifetime prevalence is estimated at about 0.3% to 0.7%, meaning fewer than 1 in 100 people develop it across their lifetime. Still, because the global population is so large, the number of affected people is substantial. In 2022, an estimated 24 million people worldwide were living with schizophrenia. In 2017, there were about 1.1 million new cases. Males are affected more often than females and, on average, tend to develop symptoms earlier. The usual onset in young adulthood is clinically important because early symptoms can be mistaken for stress, rebellion, depression, substance use, or personality changes. A person may begin struggling academically, socially, or at work before anyone recognizes psychosis. Early support can reduce harm, but stigma often delays help. Families may not know what they are seeing, and the person may fear being judged or not believed. The causes of schizophrenia are not explained by one factor. Current evidence points to a mixture of genetic vulnerability and environmental influences. Genetics play a meaningful role, but not in a simple one gene, one disease way. Many common and rare genetic variants may contribute small pieces of risk. Having a family history can increase risk, but it does not make schizophrenia inevitable. Environmental factors may also influence vulnerability, especially during brain development. These include being raised in a city, childhood adversity, infections, poor nutrition during pregnancy, and the age of a person's mother or father. Cannabis use during adolescence is also associated with increased risk, especially for people who are already vulnerable. None of these factors means blame. They are risk factors, not moral failures or guaranteed causes. Schizophrenia appears to emerge when multiple vulnerabilities and stressors interact across development, biology, and life experience. The long-term course of schizophrenia is highly variable. It is not accurate to assume that everyone diagnosed will continually worsen or be unable to live meaningfully. About half of people diagnosed with schizophrenia experience marked long-term improvement with no further relapses, and a small proportion recover completely. This improvement may involve fewer symptoms, better coping strategies, stable relationships, work or education, and greater independence. At the same time, the other half experience lifelong impairment, which can range from moderate difficulties to severe disability. Outcomes depend on many factors: access to treatment, response to medication, family and community support, housing stability, physical health care, substance use, and early intervention. Schizophrenia is often described as a chronic disorder, but chronic does not mean hopeless. It means support may need to be sustained, flexible, and realistic across time, rather than limited to moments of crisis. Schizophrenia is not only a medical issue. It is also deeply connected to social conditions. People with schizophrenia are more likely to experience long-term unemployment, poverty, homelessness, exploitation, and victimization. These problems are not simply caused by symptoms alone. Stigma, lack of supportive services, disrupted education, difficulty accessing healthcare, and fragmented social systems all contribute. A person who is hearing voices, struggling with motivation, or mistrustful of others may find it difficult to keep a job or manage housing paperwork. If services are hard to access, the situation can spiral. Homelessness and poverty can then worsen symptoms by increasing stress, reducing sleep, and limiting medication continuity. It is important to emphasize victimization because public fear often focuses on danger from people with schizophrenia, while many people with severe mental illness are themselves vulnerable to being harmed, manipulated, neglected, or excluded. Physical health and suicide risk are major concerns in schizophrenia. Compared with the general population, people with schizophrenia have a higher suicide rate, estimated at about 5% overall. Risk may be especially serious when a person is distressed, depressed, socially isolated, recently diagnosed, or aware of major life disruptions caused by the illness. Physical health problems are also more common, and life expectancy is reduced by an average of 20 to 28 years. This gap can reflect many overlapping causes, including cardiovascular disease, metabolic issues, smoking, limited preventive care, poverty, medication side effects, and the challenge of navigating health systems while living with psychiatric symptoms. In 2015, an estimated 17,000 deaths were linked to schizophrenia. These numbers show why treatment must include more than psychiatric symptom control. Regular physical health monitoring, suicide prevention, lifestyle support, and accessible primary care can be life-saving parts of schizophrenia care. The mainstay of schizophrenia treatment is antipsychotic medication, combined with psychosocial support. Antipsychotics can reduce hallucinations, delusions, agitation, and disorganized thinking for many people. Commonly used medications include olanzapine and risperidone, though treatment is individualized. These medications are not perfect cures, and they do not address every symptom equally. Some people respond strongly, others partially, and some experience difficult side effects. Side effects can vary considerably, including sedation, movement problems, weight gain, metabolic changes, or hormonal effects, depending on the medication and the person. Because of this, treatment decisions often involve balancing symptom relief with tolerability. Counseling, psychoeducation, family support, job training, and social rehabilitation are also central. Skills-based and community supports can help people rebuild routines, manage stress, recognize relapse warning signs, and participate more fully in life. Medication may reduce symptoms, but recovery often requires practical support in the real world. Up to a third of people with schizophrenia do not respond adequately to initial antipsychotic medications. In those cases, clozapine is often offered. Clozapine is considered the most effective antipsychotic overall for schizophrenia, especially for treatment-resistant cases, but it requires careful monitoring because of potential serious side effects. This is a good example of how schizophrenia treatment is not one-size-fits-all. Doctors must consider symptom severity, past response, side effect risks, physical health, personal preferences, and safety. In severe situations, if clinicians judge that there is a risk of harm to the person or to others, short involuntary hospitalization may be used. Long-term hospitalization is now reserved for a small number of people with severe schizophrenia in many places, but it remains more common where community support services are limited or unavailable. The broader goal is not simply containment. The goal is stability, dignity, safety, and the best possible quality of life. If you found this helpful, please like this video and subscribe for more explainers.